people all over America that are dying, and they're falling through the cracks. I mean, it's just appalling that in America, our life expectancy is actually worsening despite being the wealthiest country.
Welcome back, ladies and gentlemen, to another fabulous episode of the Healthcare Trailblazers podcast. I'm very excited to be sitting here for the second time, but first time in person, with Dr. Gordon Chen.
Mendel, it's wonderful to be here with you. Thank you for making that trip down.
Absolutely. So let's try to kick off from our last conversation. For those that missed it, there is a first episode that we chatted together. It was done remotely, but it is on the Healthcare Trailblazers podcast. And I wanted to come back in person to kind of continue the conversation, because there were a lot of points that I found to be fascinating and have been really going around in my head on a personal level since we've spoken. And I felt it would really be a good idea to come in and continue the conversation. So,
okay.
First off, the thing that hits me the most about perhaps the difference in ChenMed is when it comes to your employees, the teammates. You're Gordon Chen. You have to carry the as much as your passion is obvious, but it's been incredible to me talking to literally anyone in this building, from the production team to assistants to everyone that I've spoken to is completely bought in to the mission, to the vision of ChenMed, and in my estimation, that always goes downward from the top. And so I'd love to get some more insight from you on, let's start with yourself. How do you keep yourself passionate, purposeful, and not jaded by life, by running a company with hundreds of centers and hundreds of thousands of patients? How do you do that for yourself?
Mendel, I'm going to play back that question, which essentially is, Gordon, what's your why and what's your motivation? And how come you can come to work or bring your best in whatever you're doing, and then also help other people to bring their best with what they're doing? And for me, that needs to start with knowing who you are and whose you are. And I've spent a lot of time just really focusing on who I am and whose I am. What do I mean by that? Well, the who I am, if I truly believe that I'm a child of God, created with purpose, and not to exist just for the sake of existing, or not to pursue things that only satisfy me as a person, Gordon Chen. And if I shift my mindset to understand that I was created with purpose, that I was not created for myself, I was actually created, and I'm just going to speak openly here because you're asking me a very personal question, right? So just being very open. If I believe that I was created not for myself, or not to bring myself glory, but for God's glory, then everything changes after that. And then you begin to understand how precious life is. And then also understanding, as you're building your relationship with your Creator. So for me, my relationship with God is first and foremost, right? And if I understand that I am dearly loved by my Creator, and again, I'm just gonna let my personal beliefs kind of come out a little bit here. We serve a God that loves us so much that He's willing to give Himself up for us. There is a deep love there. That's a sacrificial love, and that type of sacrificial love as an example to say, wow, if we serve a God that created the whole universe, that's willing to love us in such a way to give Himself for us and to suffer for us, what kind of better example could we ask for as we're living day in and day out? And so if I'm living my days knowing that I wasn't created just for life here on earth, I was created for an eternal relationship with my creator, and my time here is short, I'm going to make every day count. And I'm going to realize that if my cup is full, which how could it not get full if the God of the universe is pouring into us? It's like, it's going to overflow, right? You're easily going to fill up because you're like, oh my goodness, you're tapping into the greatest power source in the universe, and that is God's love. Then how does that cup, once it's full, not flow into whoever else you're around? And you begin to pour into other people, and you begin to say, hey, I've experienced love. How can I love other people? And that love, again, obviously it comes in, it's not the Hollywood type of love. It is the purposeful, intentional pouring into other people for their benefit, and not for your own glory, but for God's glory. So that's kind of how I show up every day, is to say, hi, God, what do you have for me today? Life is short. Every day is precious, and I need to steward what you've given me, because I'm accountable for everything that you've given me. And if I view everything that I have as blessings, and understand that I'm responsible for taking those blessings and multiplying it, right out of Genesis, be fruitful and multiply. Then we're supposed to actually be productive with our time here. Well, let's go get it then, right? Whatever that is, let's go after it, and let's not do it let's not do it because we want to try to bring honor and glory to ourselves. No. That's like temporary.
Yep.
We're like bags of fluid floating around for a certain time period. We just happen to have this beautiful consciousness and relationship with God.
Yeah. And the gratitude that you seem to display, and the purposefulness that comes from, like you mentioned, like it says, man was born to toil, right? And it's not about you. You weren't put on this earth about you, which I think is a message that's missing from a lot of our society today. It's everyone wants something for me. And it's fascinating how the second you start doing something for someone else, you actually start feeling so much more animated and so much better about yourself. But my question to you is, I think it happens very often that when people start out to do something tremendous, like building a company like ChenMed, the purpose initially is for the success alone. Like, let me get to X amount of centers, let me get to X amount of revenue, let me get to X amount of patients helped. It could even be trying to help people. And then once they hit that level of success, they kind of have a there's like a break where they've achieved what they thought was the pinnacle of success. Now they've achieved that, and now it's like, okay, what do I do now? And that's when they have to find a deeper purpose that's beyond themselves in order to continue in such a purposeful manner. Did you start the company with the same sentiment and the same level of purpose from the same source of purpose, or did you have that kind of that did you have to refine it throughout the journey?
So again, this is a very personal discussion. I don't want to push my beliefs on anyone that's listening or you or whatever, but I do want to be authentic. You're asking me very deep personal questions, right? Yes. So we have a deep faith, and our background, is based upon Christianity, and which is essentially, followers of Christ, right? And that was very deep into our core as a family, and recognizing, again, just like, how do we serve God with everything that we have, and our lives are not our own. You know, as a Christian, you actually make the intentional decision to give your life to Christ. And what does that mean? That basically means that we've experienced and acknowledged what God has done for us and loves us so much that despite being an incredibly all-powerful, all-knowing, holy God, that we cannot even come into the presence of God without just understanding that holiness, but then to have our sins covered by none other than his own sacrifice for us. I mean, that's just a profound amount of love. So that was at our core, and then really testing it and hardening it and experiencing suffering, like getting a phone call saying, hey, your dad's going to die, got 2 months left to live, and then have it be very real. 2 months. It's a very tangible time period. We're like, oh, we can start to count days now. And how do we actually approach life when our days are numbered? Which, by the way, you can extrapolate 2 months, 2 years, 20 years, 50 years. We can start to number our days way in advance. And what that does is it brings very real perspective with what you're doing with your time. And you begin to realize that if you end up just chasing something just for the sake of chasing something, that's not going to be fulfilling. But what it forced us to do is to say, hey, life is so precious. If we can use our time, our talent, our treasure to spread God's love and God's healing, well, then what a great purpose for our lives. And again, we're emulating what we believe God has done for us, which is spread love and healing. So I mean that's the background. And a lot of people come at it and they say, hey, I'm going to do this because I want to make X amount of money, because I want my lifestyle to be this, and I want this, and I want to drive this type of car, and blah, blah, blah. And we said, like, we've already gotten like way more than we need. We're going to go out and serve God the best way we can. And we're not going to do it in an unwise way. We're going to do it in a very wise stewardship way, where we're going to try to create very effective businesses that can have durable impact in communities that are in need. Now, for us, just kind of speaking broadly, when you think about ChenMed, so we experienced that as a family. We realized that what we were doing was having very real, tangible impact on patients' lives, helping them to live longer and reduce hospitalizations and reduce suffering. And so for us, we said, what a great opportunity where we can not only just live out our purpose, live out our mission, like do what we wanted to do as we went into healthcare, which is to heal. Mm-hmm. I mean, we go to medical mission trips in Nicaragua all the time to heal people and spread love and really do what we can to serve. We're like, there are people all over America that are dying, and they're falling through the cracks. I mean, it's just appalling that in America, our life expectancy is actually worsening, despite being the wealthiest country. And basically what's happened in healthcare today is healthcare is over the curve. Physicians, we talk about like the Starling curve. I don't want to bore you, but we're over the end of the curve where we're doing too much, too hard, too fast, and then we're getting a worse result. So we need to figure out what is that right balance where you can actually do what we were called to do in healthcare or whatever, which is to heal people and help people to live longer and live better. So long-winded answer, but we started with the purpose. It was tested and reinforced by suffering and by experiencing sickness, and then really developing empathy as a family full of doctors for who we're serving and patients that are facing life and death situations. Like that's who we're fighting for.
Yeah.
And then as we grew the company, we're first and foremost continuing to think about what is the overall impact that the company can have. And when we think about growth, or we think about going after something, it's because we realize we have an ethical obligation to take an organization that has a 30 to 50% predictable reduction in hospitalizations and get it to the neediest communities.
Yeah. I think it's fascinating, and I think that there's definitely a common denominator with really great leaders in building something in the context of them subscribing to something much larger than themselves, a vision that's much larger than themselves. And so obviously, even though you have thousands of employees of multiple different faiths, or perhaps no faith, I think it's fascinating to see that when the leader of the organization is so bought into a vision that is larger than themselves, that trickles downstream to every single person in the organization. You talked about you touched on kind of the mission that you guys have the mission that you have in transforming care for patients across the country. You've come up with a model called transformative care. Recently, there was a fantastic article that you put out in the New England Journal of Medicine. If I recall correctly, the title was "The Case for Transformative Care." Really great article. Talk to us about the article a little bit and just give us a short overview on some of the basic tenets of the transformative care model.
Yeah. So in New England Journal of Medicine, the Catalyst branch of that magazine, which allows ideas to kind of just flow up and really get kicked around. And what we wanted to do, what Chris and I wanted to do in publishing The Case for Transformative Care, is to change the vision for value-based care and really kind of call out some of the things that aren't working when you talk about value-based care and say, hey, we actually need to aim much higher than value-based care. The goal is not just having every health system have a toe in the water for value-based care or one value-based contract, because the reality is when you're talking about fee-for-service versus value-based care, they couldn't be more different.
Yep.
So if you have 10% or 20% in a value-based arrangement, guess what? You're still a fee-for-service practice. But what you've done is you just created more complexity and confusion for both patients and providers. So that's not a good destination. So we say, all right, get out of the thinking of just focusing on value-based care and go all the way to the next step, which is outcomes-based care, which means you're all in to thinking about your patient's quality and outcomes and cost. And you're thinking about the whole patient. And then move even further from outcomes-based care to what we call transformative primary care. And that transformative primary care is essentially scaling the outcomes-based model. And what do you need to effectively scale and disrupt something as big as U.S. healthcare? Well, you need amazing why, which we've been talking a lot about.
Yeah.
Why, purpose, mission. And I believe that folks in healthcare today want purpose and want their why to be tied in with their what they're doing. And they want to be able to authentically be themselves in carrying out their why. They just, maybe that's why like thousands of our, we have 6,000 plus employees right now. I believe they come here because it's an opportunity for them to be their authentic self and actually living out their why.
Yeah.
So you not only need that amazing mission component, you also need the right data and the right technology to scale, because you want to be disruptive across America. But then you also need this third component, which you and I have talked about last time, which is you need this amazing leadership development culture. And it needs to start with physicians and clinicians, because you can't have healthcare, which is really just a doctor and a patient, you can't have that progress and move and transform without the doctor leading that transformation.
Yep.
And you don't really have doctors right now that are empowered, equipped, experienced to lead that transformation until you build it.
Yeah.
And so that's what we done at ChenMed. We said, listen, we want to be the best clinical leadership development organization in the world. Now, we said that boldly, and we realized like not many people are really investing in physician leadership development at all. But we wanted to then continue to pour into our clinical leaders, bring them alongside of their business leaders so that they're not one is above the other, but they can work together to really go after this broader vision that we have in ChenMed, which is to be America's leading primary care provider, transforming care of the neediest population.
So I think that the equally, if not more interesting to the physician leadership part of your model is that, and we talked about this last time, but I'd love to dig into it a little bit more. When you are practicing transformative care and you're practicing outcomes-based healthcare, where you are taking risk, both literally financially and in your general mission on the patient's outcome. And so a doctor can have they can spend the extra 5 minutes explaining something to a patient. You can have better colored brochures or maybe animations in the office. But at the end of the day, if you cannot get the patient into the conversation so that they're actually willing to be led by the doctor can lead from today till tomorrow. But if that wagon is not hitched to the horse, then it's not going to go anywhere, right? And so what have you done to be so successful in getting the patients on board with bettering their own healthcare?
Yeah. We're at a day and age where there is not a lack of data and knowledge.
Yep.
In fact, we're like data and knowledge overload. Like, how do we simplify? How do we not get too cluttered with the amount of kind of different ideas that are flowing out there? And so what you have to do is you have to transition your mindset as an organization to say you're actually not an expertise like you're not a healthcare expert. Like experts don't bring change, they bring knowledge. And we've already just aligned on it. We have too much knowledge already. So it's not about the knowledge. It's not a knowledge gap. It's a behavior change gap. And so at ChenMed, we're actually a behavior change company that's empowered by talent and technology and of course our mission. And once you realize that you're a behavior change company, you're going to start treating interactions differently. So you interact with a patient, it's not about just transferring knowledge. That's what we said, is that like that doesn't help. Unless the patient can change their behavior, then you haven't actually achieved what you're trying to achieve. And then if you want to get your patients to change their behavior, you need to get your clinicians to change their approach and their behavior. And which is why, again, we've invested so much into clinical leadership development. If you think about it more broadly speaking, if you're a behavior change company, if you were trying to change, patients' behavior, clinicians' behavior, ultimately we are a leadership organization because leadership is influence. Nothing more, nothing less. That's John Maxwell, and he's like the most authored, person in terms of leadership content, and that's really what it is. So, how do we increase our clinicians' influence? Now, you ask yourself that question, and then we have so many bright, talented people here, then they can figure out how to do that. And it comes down to having more time with patients, more interaction, selecting the right people that have the empathy for patients, people that have the right mindset for change rather than a victim mindset, more of a change and growth mindset. And then once you get the ball rolling, then you can continue to build off of that momentum.
Yeah, it seems like the answer is in the question. by asking yourself, how can you increase your influence, you'll allow yourself to be creative and come up with a solution. That's what I'm hearing.
And the problem in healthcare today is physician, clinician influence is not valued.
Yeah.
Because if you're investing more time in physician and clinician influence, you're not being as productive in an RVU fee-for-service model.
Right. I know we could sit here for 3 hours, but I just wanted to touch on, because I did not know about this special, but there's a new Netflix special called The Living to 100, The Secrets of the Blue Zones. And I came across it because I saw some of your reviews on it. It's these, for those that haven't seen it, it's these little pockets of communities around the world that all seem to have a common denominator where they live to like 90, 100 years old. And you have been kind of talking about some of the crossover between the things that you've been practicing here and your philosophy, and noticing how they've been doing a lot of those same things in those communities. If you could just touch on that a little bit, because I thought it was fascinating.
So you learn a lot when you are focused on seniors, helping them to live longer, live better, and you go into multiple different communities, 130 plus across the country, and you learn from them, right? So you zoom out, you go, well, hey, what are the commonalities? And certainly medical care has an impact, but it's a very small percentage of the impact. We think medical care is probably 15 to 20% of the impact in terms of like actually improving outcomes. So studying, Dan Buettner's Secrets of the Blue Zones, right? But then also through our mission trips to Nicaragua and learning from partnering with organizations down there that have actually scaled a community-based model that can help promote health and improve mortality and whatnot. We've come up with what we call transformative care as it relates to the pursuit of health and wellness for everyone involved. Okay. So if you're looking at not just transformative primary care, which is more narrow, but you're broadening it, you're saying, hey, what can everyone do for pursuing health and wellness? Because it impacts everyone. So you broaden that view, and we've identified 5 key drivers. And it's not rocket science. There's a personal driver, a community driver, a physical, a nutritional, and a spiritual. And if you take all of these 5 drivers and then you maximize each of the individual potential there and the synergistic potential, and you bring it together, you're going to have communities that live over 100 very commonly, and it's predictable. And so just like in ChenMed, as we can open a center and say, hey, we do these things, we're going to cut our hospitalization rates 30, 50%. We're going to help people live 5 to 7 years longer. And we've seen it over and over again. It's the same thing as you broaden it and look at the whole community. You say, hey, if you focus on these 5 drivers, any community, personal, community, physical, nutritional, and spiritual, and you're intentional about the design, well, you're going to get a much better result. And so that's what we have been calling here the broader transformative care approach.
Interesting. So are there any, is there somewhere you're going with this? Are there kind of any new initiatives or directions that you're going to be taking in that regard?
The focus moving forward is, first, how do we unleash ChenMed's full potential and really get as many communities that can benefit from this transformative primary care model? How do we get them a ChenMed center or dedicated center? Okay. The next question would be, how do you go broader and not just look at transformative primary care, but transformative care in general as it relates to society? And how do you then focus on these 5 drivers that you're talking about, like that we've been talking about: personal, community, physical, nutritional, and spiritual, and scale a transformative approach that can help create more longevity across America with this really intense focus on health and wellness? That's what I'm interested in. And there's beautiful intersection that needs to be created between how seniors live and how their health is cared for.
Well, I have to say I'm very excited because, you know, you're a man with a big vision, but what's incredible and exciting is that you've already executed so much on the vision that I'm sure that it's only going to grow in an exponential fashion. And so for those that aren't aware, besides for the book, The Calling, that you put out about a year ago, Gordon actually started a new YouTube channel, just Dr. Gordon Chen on YouTube, and seeing those clips, short piece of advice, some entertaining clips like reviewing this Netflix series. And so really great content on there. Highly recommend you go check that out. Gordon is also on LinkedIn and all the various platforms. Where else can people find you, Gordon?
I think that's a great start.
Let's start there.
Let's keep things simple.
But the YouTube is really great. And so I've been seeing the short clips and the long clips, and they're entertaining, they're great. And so I hope you keep those up, and excited to see what you as you continue to unroll this vision.
Well, Mendel, it was wonderful talking with you. And I'm glad we went deep. We didn't stay superficial. We went really deep. And, I wish you the best of luck in everything that you're doing.
Thank you so much.